with before we start with the next part, I want to go over the last part because my video was left off there. So we were studying about the cloacal fold. So between the fifth and seventh weeks of life, I said the cloacal fold, which are basically a pair of swellings. Um, can you see that this is the cloaca, which is covered by the cloacal membrane? And then by the week 7, you have these cloacal folds which were originally a pair of swellings adjacent to the cloacal membrane. They fuse anteriorly to become the genital tubercle. So this is the genital tubercle, and it fuses anteriorly to create the genital tubercle. This will in future become the clitoris. So you can see that the genital tubercle here is becoming the future clitoris, and the perineum develops and divides the cloacal membrane into an anterior urogenital membrane. Here can we see that? So the perineum develops and divides the cloacal membrane into an anterior urogenital membrane, or the one that is covering the urogenital sinus right now, and posteriorly the anal membrane. So the basically the perineum develops and divides the cloacal membrane into an anterior urogenital membrane and a posterior anal membrane. I hope that's clear now. And then we also have the cloacal folds anteriorly, and now we call them the urethral folds. Okay, so we call them the urethral folds now anteriorly, which form the labia minora. I'll show that to you. So these labia minora are formed from the urethral folds. The anterior urethral folds, the cloacal folds which were anteriorly present, were now called urethral folds, and they are forming the labia minora. Another pair of folds within the cloacal membrane form the labioscrotal folds that eventually become the labia majora. So the labia majora is formed from another pair of folds within the cloacal membrane that form the labioscrotal swellings, and that ultimately becomes the labia majora. The urogenital sinus, this urogenital sinus becomes the vestibule of the vagina, and the external genitalia are recognizably female by the end of the 12th embryonic week. So by the end of the 12th embryonic week, we have all these external genitalia that are recognizably female. Okay. Okay, moving on to the female external genitalia. Let's do this quickly. The external genitalia are commonly called the vulva, and they include the mons pubis, which is this area, the labia majora, the minora, and the vaginal vestibule, right? You can see the vestibule exactly here. This is the vaginal vestibule, and the clitoris here, and the greater vestibular glands. We're going to see them later on. Okay, now one by one let's go over them. Basically the mons pubis is the external genitalia. Okay, so the mons pubis is a fibrofatty pad covered by hair bearing skin that covers the bony pubic ramus. So if anybody asks you what covers the bony pubic ramus, you just say it's the mons pubis. It's basically a fibrofatty pad that's covered by hair bearing skin that covers the bony pubic ramus. The labia majora, here the labia majora, these are two folds of skin with underlying adipose tissue lying on either sides of the vaginal opening. Okay, they basically contain sebaceous and sweat glands and a few specialized apocrine glands. In the deepest part of each labium is a core of fatty tissue that continues with that of the inguinal canal and the fibers of the round ligament which terminate here. So basically, in the labia majora, what is important? These are basically two folds of skin, and they have underlying adipose tissue. It lies on either side of the vaginal opening. They contain sebaceous and sweat glands and a few specialized apocrine glands. So in the deepest part of each labium is a core of fatty tissue that is continuous with that of the inguinal canal and the fibers of the round ligament. So the ones that are the core of fatty tissue that is continuous with the inguinal canal and the fibers of the round ligament, they terminate here. Okay, now the labia minora are two thin folds. The majora are obviously fat folds, a little thicker folds, and the minora are thin folds. They lie between the labia majora. The minora lie between the labia majora. These vary in size and may protrude beyond the labia major where they are visible. They vary in size and they may protrude beyond the labia majora where they are visible, but also be concealed by the labia majora. So sometimes here you can see the minora are sort of extending, but sometimes they're not, right? Anteriorly, they divide into two to form the prepuce here. So basically, anteriorly, they divide, these folds divide to form the prepuce and frenulum of the clitoris. So the frenulum of the clitoris, or the clitoris head, is here, and this contains the most sensitive receptors. Posteriorly, these folds divide to form what? These divide to form, posteriorly, these folds divide to form something called the fourchette. Here, this is the fourchette. So, posteriorly, these folds, these labia minora folds, divide to form a fold of skin called the fourchette at the back of the vagina and uterus. They contain sebaceous glands, but they have no adipose tissues. They are not well developed before puberty, and they undergo atrophy after the menopause. So these folds of skin are called fourchae at the back of the vaginal introitus. They contain sebaceous glands, but they have no adipose tissue. They're not well developed before puberty, and they basically atrophy after the menopause. Both the labia minora and labia majora become engorged during sexual arousal. The clitoris is an erectile structure. Now, this clitoris area, this is an erectile structure measuring 0.5 to 3.5 centimeters in length. The body of the clitoris is the main part of the visible clitoris. So, this body of the clitoris is the main part of the visible clitoris and is made up of paired columns of erectile tissue and vascular tissue called the corpora cavernosa. So the body of clitoris is the main part of the visible clitoris, and it's made up of paired columns of erectile tissue and vascular tissue called the corpora cavernosa. These become the crura at the bottom of the clitoris and run deeper and laterally. So the body of this clitoris, this is the main part of the visible part of this clitoris, and it's made of paired columns of erectile tissue and vascular tissue, and it's called the corpora cavernosa. These become the crura at the bottom of the clitoris, and they run deeper and laterally. The vestibule is the cleft between the labia minora. It contains openings of the urethra, the Bartholin glands, and the so as you can see, the Bartholin glands here, the vestibule is the cleft between the labia minora. These labia minora surround the vestibule, and it contains openings of the urethra. So here you can see the external urethral orifice opening, and the Bartholin glands. These are the greater vestibular glands, and the vagina. The vagina is surrounded by two bulbs of erectile and vascular tissue. So this vagina is surrounded by two bulbs of erectile and vascular tissue that are extensive and almost completely cover the distal vaginal wall. These have traditionally been named the bulb of the vaginal vestibule, although recent work on both dissection and MRI suggests that they may be part of the clitoris and should be named clitoral bulbs. Anyways, we move on. Their function is unknown, but they may probably pay some support or add some support to the distal vaginal wall to enhance its rigidity during penetration. So this is about the vagina and its two bulbs of erectile and vascular tissue. So now we come to the Bartholin glands. The Bartholin glands are bilateral, about the size of a pea. They're bilateral on both sides, they're about the size of a pea. The pea, like the princess and the pea kind of pea. They open via a 2 centimeter duct into the vestibule below the hymen and contribute to lubrication during intercourse. The hymen is a thin covering. This hymen, which is sort of a bit imperforate right now, the hymen is a thin covering of mucous membrane across the entrance to the vagina. It is usually perforated, which allows menstruation. The hymen is ruptured during intercourse, and any remaining tags are called carinculae myrtiforms. So whatever remaining cords are present of the hymen, you call it carinculae myrtiformis. Okay, just a word that popped up, so I would rather you guys know it. Now we look at the vagina. The vagina is a fibromuscular canal lined with stratified squamous epithelium. So the stratified squamous epithelium leads from the uterus to the vulva. So all the way from after the uterus, all the way till the vulva, we have the stratified squamous epithelium. It is longer in the posterior wall, approximately 9 centimeter. Then in the anterior wall, approximately 7 centimeter. So the posterior wall is of the epithelium is 9 centimeter, and the anterior wall is 7 centimeter. Now the vaginal walls are normally in apposition, except at the vault where they're separated by the cervix. The vault of the vagina is divided into four fornices: posterior, anterior, and two lateral. So you can see these posterior and anterior fornix or fornices. And otherwise, you have two lateral ones also. So you can see the vagina here, and I told you that the posterior. This is the vagina, this is the urethra, this is your bladder, and this is your anus. And I told you the posterior wall is 9 centimeter and the anterior wall is 7 centimeter. And here you can see that the posterior wall is longer than the anterior wall. And now they're saying that we have four fornices. So if you look at this from the superior view, you can see the anterior fornix, you can see the cervix up there, and the two lateral fornices and the posterior fornix, right? Now the wall of the vagina, we've seen that it's divided into four fornices. The mid vagina is a transverse slit, while the lower vagina is an H-shaped, like H for horse, in the transverse section. So the mid vagina is a transverse slit, while the lower one is an H-shaped in transverse section. The vagina walls are lined with transverse folds. Here you can see those transverse folds, right? The vagina has no glands and is kept moist by secretions from the uterine and cervical glands and by transudation from its epithelial lining. So the epithelial lining of the vagina accounts for most of its transudation. The epithelium is thick and rich in glycogen, which increases in the post-ovulatory phase of the cycle. So the post-ovulatory phase, the epithelium becomes fully thick and rich in glycogen. However, before puberty and after the menopause, the vagina is devoid of glycogen due to lack of estrogen. So estrogen is responsible for the glycogen in the epithelium. Now we have something called as the Doderlein bacillus. I'm going to show you what is this. This is the Doderlein bacillus. This is a normal commensal of the vaginal flora. I'm going to write the name here. This lactobacilli is really important for us. And why is it important? Because it's part of the normal flora of the vagina. The Doderlein bacillus is basically a lactobacilli. And what it does is it breaks down glycogen to form lactic acid. Now this produces a pH of around 4.5. This is pretty acidic. This has a protective role for the vagina. It decreases the growth of a lot of pathogenic bacteria. The upper posterior wall forms the anterior peritoneal reflection of the pouch of Douglas. So the upper posterior wall of the vagina, this is basically the rectum. This is your bladder and urethra, and this is your uterus, and this is your vagina. So here when we look at this, the posterior part, the upper posterior wall of the vagina basically forms part of the anterior peritoneal reflection of the pouch of Douglas. This cul-de-sac is basically the area of pouch of Douglas. This is also called as the recto-uterine pouch because it's behind the uterus. It's also known as cul-de-sac. And we can do something as cultocentesis here, where we check for any abnormal fluid in the abdominal cavity behind the uterus. So the middle third is separated from the rectum by the pelvic fascia, and the lower third abuts the perineal body. So the middle third is separated. The upper posterior wall forms the anterior part of the pouch of Douglas. The middle third is separated from the rectum by the pelvic fascia, and the lower third abuts the perineal body. Those are the three lower parts of the vagina. Anteriorly, the vagina is in direct contact with the base of the bladder. So this is the bladder, and anteriorly it says it's in direct contact with the base of the bladder. So this is your bladder, and here you can see it's very close to the base of the bladder, the vagina. This is your vagina, and it's very close to the base of the bladder, right? While the urethra runs down the lower half in the midline to open into the vestibule. So here the urethra, you can see, while this urethra basically runs down the lower half in the midline to open into the vestibule. So this is the entire vagina, and here the urethra is opening into the vestibule. This entire area is surrounded by the labia minora, majora, and this is the clitoris. So you can see that the urethra runs in the midline and it opens into the vestibule, right? Now, something else is laterally at the fornices, the vagina is related to the cardinal ligaments, right? Now we're going to see the vagina and how it's related to the cardinal ligaments. Now, the cardinal ligament is basically this transverse cervical ligament. And what it actually is, this cardinal ligament is not a true ligament, it's a condensation of pelvic fascia. It runs horizontally and sort of connects the cervix, upper vagina, and lateral pelvic wall. So remember that this is why it's the main support of the uterus and vaginal wall, because the cardinal ligament, it's a condensation of pelvic fascia. It's not a true ligament. It runs horizontally. It connects the cervix. It connects the upper vagina, and it connects the lateral pelvic wall. So it's the main support of the uterus and the vaginal wall. Here you can see the cardinal ligament. This is really important. It's a very important support for the cervix, for the uterus. Here the uterus and the vaginal wall. Relation of the vagina to the cardinal ligament is basically a key concept. Only the upper part of the vagina is related to the cardinal ligament. So you can see the upper 1/3 of the vagina near the vaginal fornices is related to the cardinal ligament. It's basically embedded within the cardinal ligament. The lower 2/3 of the vagina has no direct relation to the cardinal ligament. So the cardinal sort of holds the vault of the vagina. The vaginal vault, the upper vagina, it's held by the cardinal ligament. What exactly passes near the vagina in the cardinal ligament is really important. In the image, the cardinal ligament lies lateral to the upper vagina, right? And it contains basically the uterine artery, the uterine vein, and the ureter is just inferior and posterior to it. So remember that. This is why upper vaginal surgery can cause massive bleeding, because the ureter is at risk during hysterectomy, right? Since the uterine artery is here, so there's a risk of massive bleeding, and since the ureter is here, the ureter is at high risk during hysterectomy. Okay, so the vagina does not really hang freely. It is suspended laterally at its upper end by the cardinal ligaments. Now, sometimes you have a vaginal vault prolapse, and this occurs when cardinal ligaments weaken, and this is very common after hysterectomy. Sometimes there's a radical hysterectomy where the cardinal ligaments are cut, and you must identify the ureter to avoid injury. And sometimes the cervical cancer spreads laterally via these cardinal ligaments, and it goes to internal iliac lymph nodes. So the cardinal ligament directly supports the upper vagina. The uterosacral ligament, this one, this is posterior to the vagina. The broad ligament, this covers structures but does not support it. It does not support the vagina, the broad ligament. And the round ligament, this one, has no relation to the vagina. Okay? Moving on. So below this area, you have the levator ani muscles. These are the levator ani muscles. Can you see the levator ani coccygeus? They make part of the pelvic diaphragm here. And apart from the levator ani muscles, you also find the ischiorectal fossas here. These are the two ischiorectal fossas. And the cardinal ligaments, which I just talked about, and the uterosacral ligaments, which were seen in the previous image. This is the uterosacral ligament, and this is the cardinal ligaments. They posteriorly, basically, they're from the perimetrium. Then they support the upper part of the vagina. And that's it for the external genitalia. I will now move into in the next video. I will start from the internal genitalia. So we're going to talk about the uterus. We're going to talk about the bladder, the urethra, and the tubes, and so on.